I'm Jennifer, I'm your nurse. Thank you for welcoming me into your home. I'm going to go ahead and gel up with some hand sanitizer. I see that you're sitting in a firm chair, and that's what we need to do for this assessment. Okay, so let's go ahead and get started. Can you tell me your full name and your age?
PJ Santos, age 66.
Yes, sir. And then what's today's date?
February 1st, 2022.
Okay, what city are you living in?
Amarillo.
Yes. Do you have any hearing problems?
No, ma'am.
Okay, I'm going to go ahead and do the whisper test. I'm going to whisper a word in each ear, and then I want you to repeat that word back to me, okay?
Red brick. Train track.
Yeah, very good. You don't have any hearing problems. Okay, the next thing we're going to do is the nostril test. Are you having any difficulty breathing?
No, ma'am.
Okay, I want you to pull down your mask and put one hand up against your nostril to close it, and then just breathe through that one nostril. Inhale, exhale. Yes, very good. Okay, yep, that's good. And then do the same on the other side. Okay, any difficulty breathing through your nose?
No, ma'am.
Okay, good. The next thing I'm going to do is feel your lymph nodes. This is postauricular, I'm feeling right now. Your submandibular and your supraclavicular.
Good.
Okay, and I didn't feel any swelling or anything, so that's good. Then I'm going to test your extraocular movements. So I'm going to hold this pen and want you to keep your head steady and then just look with your eyes. Okay, you did great. Okay, the next thing I'm going to do is take a listen to your heart and your lungs, okay?
Okay.
I'm going to listen to your heart first. Okay, your heart sounds strong and steady. Then I'm going to listen to your lungs. Deep breaths for me. Okay, sounds good so far. The lungs are clear. I'm going to listen to it in the back also. Inhale and exhale. Okay, yeah. Your lungs are clear.
Okay.
All right, the next test is for muscular strength. I want you to move your head forward against my hand and press against it. Very good. And then do the same thing with the other hand. Okay. And then I want you to shrug your shoulders up against my hands. Okay. Then I'm going to squeeze your hands. Or actually, I'm going to have you squeeze mine. You can test my strength too. Okay. And then with your palms down, yep, I want you to, yeah, just like that. Okay. And then go down. And then go out, okay? And then resist my hands, okay? And then I want you to raise your knees up against my hands, okay? And then I'm gonna go down here. I want you to move your feet back against my hands, yep. And then also in the front, okay? And then I want you to lift your toes up against my hands and down. Okay, don't crush me. All right, so that was all good. You were very strong. Then I'm going to do the Tenetti assessment. The Tenetti assessment is the balance test and the gait test, and then we combine the scores to assess your risk for falls. So I need you to go ahead and stand up for me. You don't use a walker or cane, correct?
No, ma'am.
Okay, go ahead, stand up for me with your feet about 4 inches apart. Let's see. I am going to test your balance first. So I have a hand behind you and I'm just going to press against you 3 times. Okay. Very good. Okay. next thing I'm gonna do is have you close your eyes for 10 seconds.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Very steady on your feet. Good job. Okay, then I want you to turn in a full circle. It doesn't matter which way. Okay, and then after you do that, go ahead and sit down. You feeling okay?
Yes.
No lightheadedness or dizziness?
Nope.
Okay. That part's over. We're going to test your gait to see how well you walk. So stand up for me again, and I want you to take 10 steps. Just go down the living room and then come back. Okay, good job. You don't have any issues there. You walk well. You don't need any assistive devices. Okay. Let's see. You don't have any signs of being a fall risk from the Tenetti assessment. Very good. And I noticed whenever I came in, I was looking around. I didn't see any rugs or extension cords. I don't see any clutter. Do you have any pets?
2 dogs.
You have 2 dogs, okay. Do they sometimes get under your feet
Yes.
whenever you're walking? Okay, so that's something that you need to be aware of. You just need to be careful. Make sure that you don't accidentally trip on one of them. It's really easy to do. Okay. And then, do you have any grandkids?
No.
No, okay. And you're able to walk into all of your rooms okay with no issues? You know, obviously,
Yes,
okay.
ma'am.
And we talked about this before. You don't have any Medicare or any supplemental insurance? No. Okay, so if you need help with getting your medications, then there's community services and there's discount programs that I can look into for you. Where do you keep your medications?
In the bathroom locked up.
In the bathroom locked up. Okay, very good. That's the best place for them. Okay, do you have any questions for me?
No, ma'am.
Okay, well, it's very nice meeting you. Go ahead and gel up again.
Yes, ma'am. That's fine.
Okay.